Wow, guys and girls, this is MTP 64. We've done a lot. Sometimes I don't even remember if I've covered topics before, so that's scary. But this is a great one. This one here, Pete V. And the first line of his letter is, I really hope this one makes it to MTP, and he has some kind of emoji with teeth on it. So, hey, you got it, Pete V. This is a great one, though. Doc, can you talk about your opinion on the vertical penoscrotal approach, which a doctor in New York City believes is much better for the patient? I realize doctors have different opinions, and I would love to hear yours on the below approach and comparisons. And then he goes on to take a quote, I guess, from this doctor's website or something that this doctor said. I don't know who it is. I have an idea, and believe it or not, all of us that are high volume implanters, we're all very much friends. So let me tell you, there's three approaches. There's penoscrotal, there is subcoronal, and then there's infrapubic. 6 months down the road, a well-done implant with any of those approaches is going to be the same 6 months down the road. Anybody that says anything different they're not comparing apples to apples. They're comparing apples to oranges. And some of the things that are, I can't even read this paragraph because the things that they're saying are bad about our approach, which is the infrapubic or the subcoronal, are things that can happen, when not performed by somebody that does that type of approach every single time. They talk about seeing tubing above the penis on an infrapubic. Well, you can see it below when it's done inappropriately penoscrotally. I can take all three approaches and rip them apart when done in the hands of people that should not be doing them. The reality is a penis is a penis is a penis, and that's normally not what I say if you're sitting in my office. I'm sure it's much more vulgar. It doesn't matter which approach you use as long as it's a dedicated implanter. Now, this colleague of mine, he feels that he's got to boost his approach or her approach. Really, if you have a dedicated implanter, any of those approaches are going to be appropriate for your penis. So take that paragraph, Pete V, with a grain of salt, because I can't even read it. I can't stomach it because it doesn't make sense. What does make sense is that I'm sure that this surgeon would do a great job with his or her approach, which appears to be penoscrotal, because that's what he's really touting. So even the high volume guys and girls are going to have their own pitch. And you're right, we all have our own opinion. But 6 months down the road, all three approaches are equivalent, if you really want to know Pete V. And I love it, and I love the emoji. So we'll talk about getting to some of those better surgeons on the next MTP. So see you then.